We're having a hard time finding qualified nurse educators. We need more educators with a PhD. We need more educators with an MSN. How many of you have heard these comments over the past year or even the past 2 years? It's no surprise that we are in a position where we need more qualified faculty. When we're faced with so many competing parties, it can be a challenge to stay focused on using evidence-based practices. We started this series looking at what are those 12 biggest mistakes that nurse educator colleagues are making across the country as they continue on their nurse educator journey. So in this snapshot, we're talking about the third biggest mistake when we think about some of those challenges. And most importantly, how do we move past those challenges to make sure that we're doing the very best that we can in the classroom to support our students' learning experience. So we're going to take a look at our thought-provoking question. All right. And so for those of you that are joining us for the first time, welcome. We're glad that you found us. If you're returning, then you already know the drill. First, we want you to pull out your study worksheet. That is listed right here in the description. Okay. And on the study worksheet, what you're going to do is you're going to put the date. Okay. So that's where we want you to start. What is today's date? The date that you're watching this snapshot, whenever that may be. We know that some of you are watching us as we launch this snapshot. Others may be watching us months or even years later. Okay, so whatever date you're watching it. And then we want you to, second of all, write down your objective. So you showed up here and we're glad that you did. What is going to be your takeaway as we end our time together today? What is it that you want to know more about or accomplish as a result of the time we spend together? And then the next step you're going to do is go ahead and pull out Billings and Halstead Teaching and Nursing. You may have the 6th edition, which this is the one that we have, or you may have the 7th edition. Now, the reason why we're continuing to use the 6th edition is because this is the one that was used to write the exam questions, okay, currently for the C&E. We're going to go ahead and turn to some of the resources in Billings and Halstead. The first chapter I want you to take a look at is a different one. Okay, so it's chapter 15. This one is titled Managing Student Incivility and Misconduct in the Learning Environment. I want you to turn with me to page 279. If you have the 7th edition, you will see the crosswalk listed right here in the description. Thanks to Elsevier for providing that to us. I want to bring to your attention on page 279 the steps that we should take in order to respond to student misconduct. Okay, so number one, gather and document information, just like when we were practicing as nurses, and some of us may still do. If it's not documented, it wasn't done. You also want to take notes to help you remember, okay, so to recall the facts based on the discussions that you had, the meetings that you had with the student, or what your observed behaviors were related to that student's incivility. Number two, engage and confront the student about behaviors observed. Number three, focus on the behavior, okay, not the individual. Number four, outline expected or required new behaviors. Number five, outline consequences of compliance and non-compliance. So having clarity with the student regarding their behaviors is important, but what do we expect to happen and what does that look like to be in compliance? And then number six, refer unresolved or risky cases to other campus resources. And you may wonder, why is she reading them out loud? Well, there's a reason behind it. When we take a look at the blueprint, okay, so that's the next resource. If you haven't already printed it out, we're going to actually go ahead and share our screen and go there together. So this blueprint is actually listed right on the NLN website. Okay, so this is the C&E blueprint, but each of the exams have their own handbook, and they also include in the handbook a blueprint. All right, so what you will notice is that 47 questions. Yes, 47. This is for the C&E. 47 questions are from competency 1. Okay, and this is what we know about competency 1. Between the concepts that we're discussing under competency 1 and competency 2 for the spring series that we're in right now, that is going to be 50% of the exam questions. Okay, so I want to stop sharing just for a second. 50% of the exam questions are aligned with competency 1 and 2. All right, so take a look with me at competency 2. Who can put in the chat how many questions are aligned with competency 2? All right, you can use your notes on page 6 in the handbook. All right, so if you guessed 18, you are correct. So 18 questions from competency 2 and from competency 1, 47 questions. I know that's probably hard for you all to see. All right, so 47 plus 18 for the math whizzes out there. That's a total of 65. Okay, 65 questions. Well, we know there are 150 total questions on the exam for CNE, CNE novice, and CNE clinical. And we know that 130 of those are going to be scored, okay? And out of those 130, 65 questions are aligned with competency 1 and competency 2. So what does that mean? You want to be laser focused on these concepts. You want to make sure that you're looking at all of the behaviors, sub-competency behaviors that are listed on the blueprint under competency 1 and competency 2. We heard from a colleague last week that they really struggled with some of the questions on the CNE exam, and they felt like they were strongly aligned with competency 1. And the first comment they said was, I had no idea there were going to be so many questions related to facilitate learning. Remember that it's no surprise that competency 1 has 47 questions aligned with it. Our ability to facilitate learning really is that foundation for helping our students learn. Remember, it's not enough to only teach, to come up with that wonderful teaching strategy and plan. It's most important that we're able to validate that learning has actually happened, okay? And civility can be a disruptor in the classroom when we think about the strategies we're using to help students learn, to help them grow, to help them really think differently. When we think about Tanner's clinical judgment model, we want to be able to guide students on that journey towards learning, okay? So that's what I want you to think about. The other step I want you to consider as you're mapping out what your next steps are going to be for your CNE journey, I want you to take some time to do a really transparent look in considering where your knowledge gaps are. Okay, so going back to the actual blueprint, we'll go back there together now. I want you to do a self-assessment, okay, if you haven't already, and think about where are your gaps. NLN is not trying to trick us, okay? Just take your time going through each of these sub-competency statements to make sure you understand what is being asked of you related to that sub-competency statement. Remember that these specific descriptors or content areas under each competency is aligned with an action verb, right? There should be action happening, execution, right? Also aligned with that application and analysis levels for the CNE exam that you see right here, because 70 to 80% is going to be aligned with those mid to upper levels of Bloom's taxonomy. All right, and this is going to segue us nicely into the content that we're going to be talking about today, which is related to what those pitfalls are associated with the learning process for our students, and how do we equip ourselves in a way that's going to leverage our expertise as a nurse educator and as a clinician to be able to facilitate that learning process that we know is critical when we think about not only Bloom's taxonomy, but also thinking about our mapping, the alignment with the actual next gen, okay? And I know that not everybody here teaches in the pre-licensure program, but remember that the exam questions, and really when you look at these sub-competency behaviors, they are strongly aligned with that pre-licensure learning experience that we engage our students in. I wanted to share a few of the evidence-based practices. I want to demonstrate those for you in our conversation today. We are exploring the active learning strategies that we want to develop in order to create the best learning experience for our adult learner. This is an example of what your objective should look like, okay? We want to be very intentional in identifying those active teaching strategies, first of all. And second of all, we want to make sure our objectives are learner-centered, okay? So here's an example. The learner will be able to list 5 evidence-based reasons to engage in active teaching strategy. The learner will be able to identify 5 key active learning strategies that align with brain-based learning. Number three, the learner will be able to describe why engagement in active learning is important as a nurse educator. Okay, so right out of the gate, we talk about what expectations learners can have of us as we collaborate and really partner in the learning journey, in the learning process. So when we talk about learner-centered, let's be very clear so we're all on the same page. Active learning is a learner-centered approach. Our ability to think about how we're going to engage and really exchange knowledge with our students. How is that transference of knowledge going to actually happen? Well, it has to be active, right? We know that there should be very limited passive learning opportunities that we develop in our classroom. It is effective. That's our why, specifically as it relates to adult learners. And if we're able to leverage prior learning or prior experiences that students have had, that enriches the learning experience even more. It allows students to really see themselves in the conversations that we're having, the discussions we're having in our classroom, and the work that they're doing independently or with a group. It also allows us to tap into the variety of learning styles that we know are evident in the classroom. And when we think about facilitation, there's a couple of goals that we should think about. We want to think about, yes, the what, right? We always think about that in nursing. What is it that I have to teach? What is it that I want to make sure I get accomplished during this learning experience with my students? And of course, I'm thinking about the who's in the room, what level of students do I have? Is this second semester, third semester, along with those objectives? And then how am I going to adequately align based on Bloom's taxonomy my learning experience, my active learning experiences with my students today in order for them to connect the dots, right? I don't want to speak too high level from a clinical standpoint that they miss the whole boat, right? We want to pick up on those nonverbal cues, the deer in the headlights look, I like to say, with our students as we think about how we facilitate the learning process and then thinking about the why. Why is it that we want to engage in active learning? Why is it that we want to stimulate and really motivate our students to have that internal drive when it comes to the learning process? Well, what is brain-based learning anyway? Okay, so this is an example of why it's so important to level set. I talked earlier about the definition of active learning. How would you all feel if I continued to talk about active learning and you really didn't know what that means? Or perhaps you know what it means to you, but you're not sure if we're on the same page. Well, brain-based learning, as I explained this specific concept, this is another example of how you want to level set because I mentioned that in the learning objective. But if you have no clue what I mean by brain-based learning, you can see how with our students, we get off track from the very beginning, laying out learning objectives that, yes, are learner-centered, but maybe some of the terms also need to be defined that we're including in our learning objectives. So simply put, brain-based learning simply says that it is centered in the concept of neuroplasticity. This is the ability to create new neural connections through life. Well, how do we do that? That sounds fancy, right? Not really. It's just new knowledge. It's just new information. We are engaging students in the actual participation of learning, right? To promote problem solving, such as clinical judgment. When we think about Tanner's clinical judgment model or NCSBN, we want to generate these new neural pathways. And the way to do that is by engaging students in the learning process. All right. And before we go on, we're going to go now to the thought-provoking question, just to make sure everybody knows what that is. And then we'll come back to our content as we wrap up our time together today. So go ahead and put on your paper for me, because I know that not everybody may have the resources. So I want to make sure that everybody's on the same page. So go ahead and write down for me, even if you don't have your even if you don't have your study worksheet, I want you to go ahead and write down for me what your number one so far takeaway is. Okay, before we even go any further, I want you to write down what is your number one takeaway. It could be that you wanted to, as an example, explore some of the concepts, take a deeper look at some of the concepts that we're talking about as it relates to, as an example, brain-based learning. Or you may feel like you're not even sure about the 65 and what that really means. Maybe that was new information for you today. But whatever it is that you're thinking about right now, that is a big takeaway for you, I want you to write it down, okay, as I find the next slide that we want to bring up. All right, so you're writing down what your number one takeaway is. And then the second point I want you to make or write down is go back to the page numbers that I gave you, okay, when we first started. And I want you to write down out of those 6 steps, I want you to write down which one is it that was a surprise for you. Okay, so number one, you're writing down what is a fact or what is a question that you're going to go back and now take a deeper look at. And then number two, looking at those 6 steps associated with how to deal with incivility or inappropriate behavior from students. Which step out of the 6 is questionable for you or was a surprise for you? Okay, because I want you to go back, take a look at the content, a deeper look at the content as your debrief for today. All right, I think I found our thought-provoking question. See, that's what happens when you have 10 tabs and 20 windows open, right? That's what happens. All right, so here we go. So let's take a look at this thought-provoking question, just in case you all haven't had a chance to look at it. So Dr. Morgan notices increasing disruptions during class, including side conversations and late arrivals, despite reminders the behavior persists and affects class morale. Which strategies should they implement to improve classroom management? A, develop clear classroom policies collaboratively with students to promote civility. B, ignore disruptions, focus on content delivery and post a civility reminder. Or C, implement punitive measures for all disruptions to reinforce the policy. All right, so I'll give you a second to think through those options and check the 2 questions that we always want to ask ourselves. Number one, what is this question really asking me? And second of all, what is it that I know for sure about content in this question? Okay. So think about what your answer is. Maybe you start with narrowing it down to 2. Okay, so maybe you figure out which one is automatically eliminated. You know without a doubt that's not the correct answer. Okay, so you can go ahead and eliminate that one. And then maybe you're stuck now with just 2. And you want to think about those 2 questions, those 2, I like to say, paring down questions that really are going to help you get to the next step on your journey in clarifying what is going to be the best answer for that question. All right, so now we're going to take a look at our last section of content, and then we'll go back to our thought-provoking question. All right, and hopefully everybody will have their answer by the time we go back. So just to expand on what we talked about earlier, from a lifelong learning perspective and that adult learner, this is related to Malcolm Knowles' adult learning theory work. His work simply says that adult learners actually do have the capacity to adapt or to pivot and learn throughout their lives, right? We call that scaffolding. We take prior knowledge, we take prior learning, and we build on it over time. It allows us to really design curricula that harnesses their prior knowledge, leverages it to support and continue that growth that happens within that student's mind, okay? And sometimes it's a matter of us pulling it out of them, creating those active learning strategies in a way that they have a chance to share what their learning has been. We're able to do that through a framework called andragogy. Okay, so the learner is actually at the center of the process and they grasp content and material from a lot of different sources. Well, what sources could that be? I want you to write down 3 sources that you know learners pull or draw information from. Okay, of course, number one we know is faculty. Okay, so go ahead and write down some others, maybe 2 others that you think about as you think about the interactions you're having with your students. Where do students gather data from as it relates to their learning process? Okay, so as you're thinking about where those other 2 sources of information or data or content come from, I also want to invite you all to explore our C&E review on the go. I know some of you have asked about this. We were excited to launch it last year. And so if you haven't already, we highly encourage you to consider the C&E review on the go. Now, there's 2 major benefits as we talk about adult learning. First of all, how many of us spend at least 2 hours a day on our phone? All right, so I'm sure probably at least 80% of the hands are raised. Well, this is a modality that we know evidence tells us is actually happening, right? Our adult learners are using technology such as their phone to keep them updated with information, okay? And the second reason why is because this keeps it easily accessible to you. So It's a device that you already have access to, right? Because you're checking messages, you're on the phone. And then the second step is it keeps it close to you so you don't have to hunt for papers, or you don't have to wait until you get in front of a laptop to explore concepts that you want to study to get you ready for the C&E. Okay, so you can scan the QR code, and there's also a link in our description. Who benefits from active learning? Everybody does, right? Our community does, our patients do, because students have had a chance to practice those hands-on experiences through the active learning, the collaborative efforts that we create through our learning experiences with our students. Our stakeholders, students are one of our stakeholders as well, healthcare organizations, because our students graduate practice ready. And another benefit that I think is sometimes overlooked, when our students pass NCLEX the first time, they are able to transition into practice quicker, right? Or as expected, because nobody plans for students to not pass the NCLEX when it comes to their healthcare organization and when they're going to start work. So it can be a disruptor whenever we don't engage active learning in a way that supports student success on the NCLEX exam. And then, of course, our academic community, because students are able to progress in our nursing programs. They're also able to pass NCLEX the first time, which is what we all want. Your journey is about a transformation. Yes, transactions happen in our classroom when we're sitting in the seat, just like you all are. It's the same for our students, right? There's a transaction, there's an exchange of information. That's what a transaction is. It's an actual exchange. However, we want to think higher learning, right? We want to think higher development. We want a transformation to happen. We don't want you to be the same at the end of the snapshot as you were at the beginning, right? We want you to hopefully have grasped new knowledge, new tools, new resources as you plan your path towards C&E success, or nurse educator success, or nurse success. So what's your number on a scale of 1 to 5? So 1 is you feel lost. 5 is you're ready to teach, related to content that we have explored in our time together today. Okay, and of course I have to mention one of my favorite chapters. Chapter 15 is the chapter that we started looking at as it relates to what your strategies are going to be when it comes to incivility. But chapter 14 is one of my favorites when it comes to exploring active teaching and learning strategies. Brain-based learning is on page 263 for those inquiring minds. And for those that do have our study workbook, you are in part 1, okay? Part 1 really hones in on these 47 questions that are mapped to competency 1. If you haven't already, check out our spring series. Our next session is probably already passed by the time you all watch this snapshot, but do know that we have a spring series that's going on now, okay, through, I think we put it through May, okay, and then we'll start our actual summer series after that. All right, so thank you all for hanging in with me. Now we're ready to go to our thought-provoking question. All right, so hopefully everybody has had a chance to write down the correct option, we hope. But if not, we don't want you to stress out about it, right? Because here's the good news. We don't write questions for NLN, okay, for any of their C&E exams. That would be a conflict of interest. However, we call these thought-provoking questions for a reason. We want it to stimulate thought. We want to talk through the rationale for the correct answer and the incorrect answer in hopes that you'll be able to discern where your gap areas are and move forward on your 7-week study plan, or your 12-week study plan, whatever that looks like. So if you chose A, you are correct. So give yourself a round of applause. And the reason why this is the correct option is because it highlights the importance of student collaboration and policy development, which fosters accountability and buy-in. Now, for those of you that felt like it was a tough choice between A and maybe B, B is a good option, but the reason why is because we don't want to ignore behavior, right? We want to address it in a professional way, just like the 6 steps talks about in Billings and Halstead. And then C was incorrect because punitive approaches can harm the learning environment. Chapter 15 also explores that in the 6th edition. So if you didn't choose the correct answer, you have resources starting with Billings and Halstead to help you clarify your muddy points, all right? Because that's what this is about. It's a journey about transformation, clarity around the concepts that we've talked about, and hopefully equipping you with the additional support you need to achieve nurse educator excellence. We hope that this snapshot has been helpful, and we look forward to seeing you in the next one. Have a great one, everybody.